All right, good afternoon, everybody. Welcome to our daily press briefing. COVID-19 continues to be a very rapidly evolving situation here in Montgomery County. We have a lot of information to share with you today, just a lot of updates on social services and things like that. So do bear with us. We have a lot of fairly lengthy prepared remarks, and then we will, of course, be happy to take your questions. So since our press conference yesterday, we have 4 new presumptive positive cases of COVID-19 in Montgomery County, which brings us to a total of 34. The first is an adult female, 72 years old, who resides in Upper Providence Township. This individual is currently hospitalized. The source of infection is unknown at this time. Contact tracing is complete. Based on the information we have thus far, this does appear to be a case of community spread. Second is an adult female, 31, who resides in Lower Providence Township. Her symptoms do not require hospitalization, and she is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County. Contact tracing is underway. Third, an adult male, 39 years old, who lives in Lower Salford Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual has extensive travel in the United States, and contact tracing is underway. Fourth is an adult female, 42, who resides in Lower Providence Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in the county. Contact tracing is completed. So we are trying to continue to reinforce why we need these social distancing and mitigation measures. I want to share with you our quarantine numbers. Friday, March 13th, we had 229 people in quarantine. Yesterday, we had 416 in quarantine. As of this morning, we have 471 people in quarantine. So I want to give a bunch of updates on our county essential and emergency operations. Limited county and court operations will be available on March 18, 2020. For any employee or member of the public that must come to our buildings, please be sure to practice safe distancing, good hand hygiene, and know that our buildings are all under an enhanced cleaning protocol to assist in minimizing risk. Our Human Services Center, Willow Grove, Pottstown, and Lansdale offices are closed to the public. One Montgomery Plaza will be open for domestic relations and orphans court filings only, just for filings. Correctional facility visits are canceled. Adult probation and juvenile probation is suspending all home visits and direct community supervision contacts. Contacts will continue via phone, FaceTime, texting, or emails. Domestic relations conferences and hearings are canceled. Domestic relations filings will be accepted from 9 a.m. to 3 p.m. only, and just be prepared as there are minimal staff on site. Health and Human Services will continue Children and Senior Protective Services investigations. HHS is working with the state to provide telehealth methods to continue mental health and drug and alcohol services. The Veteran Shuttle program has been suspended. Other veteran benefit services will be available online and through telephone. Passport applications will be suspended. Recorder of Deeds is working with the state to extend notary expiration dates. Human Resources will continue to take online applications. Archives will be closed to the public. Our Fiscal and Purchasing Department is working remotely and will continue to submit orders and provide payments to providers. Our limited services schedule will be listed on our website. We encourage everyone to visit the website, moncopa.org, to find out how to receive our services. Please know, as this public health emergency evolves, there may be changes to the public service schedule. Now, specifically for courts, I've been asked to share with you that per the Supreme Court's orders dated March 12, 2020 and March 16, 2020, President Judge Thomas Del Ricci has declared a judicial emergency in the 38th Judicial District from March the 12th through April the 14th, 2020. the operation of Rule of Criminal Procedure 600 shall be suspended in the 38th Judicial District during the period of the local judicial emergency. Please visit the court administration page on our website for more information about limited services and closures. Guidance as to what constitutes an emergency will be available on the court's website as of March 18th. The court's hours of operation will be from 9 a.m. to 3 p.m. Our goal is to provide as many county and court services as possible without putting any county employees or members of the public at risk. We are taking these steps to meet our responsibility to minimize the transmission and spread of the virus. We would like to thank the tremendous effort of our information technology team, security, public property, and all of our department heads, our row officers, and courts in taking steps to ensure the continuation of services along with securing the health and safety of the public. These folks have done an amazing amount of work in a very short amount of time. Now, I want to clarify, I want to share with you some clarification that we got from Governor Wolf regarding essential and non-essential businesses. This is from Governor Wolf. Essential services and sectors include, but are not limited to, food processing, agriculture, industrial manufacturing, feed mills, construction, trash collection, grocery and household goods, including convenience stores, home repair, hardware and auto repair, pharmacy and other medical facilities, biomedical and healthcare, post offices and shipping outlets, insurance, banks, gas stations, laundromats, veterinary clinics and pet stores, warehousing, storage and distribution, public transportation, and hotel and commercial lodging. Although these businesses may remain open, the Wolf administration continues to encourage them to employ social distancing practices and encourage Pennsylvanians to be thoughtful in whether or not they visit these businesses. This is also from Governor Wolf. Non-essential businesses include public-facing industries such as entertainment, hospitality, and recreation facilities, including but not limited to community and recreation centers, gyms, including yoga, bar, and spin facilities, hair salons and barbershops, nail salons and spas, casinos, concert venues, theaters, sporting event venues, and golf courses, retail facilities, including shopping malls, except for pharmacy or other healthcare facilities within retail operations. Further, the governor has ordered that all restaurants and bars close their dine-in facilities to help stop the spread of COVID-19, just the dine-in. Businesses that offer carry-out, delivery, and drive-through food and beverage service may continue to do so. But eating and drinking inside restaurants and bars is temporarily prohibited. These businesses offering carrying out, delivery, and drive-through food and beverage should employ social distancing best practices and be aware of the Trump administration's guidance to avoid gatherings of 10 or more people. So that was all from Governor Wolf's office. Now some updates on testing. As you know, we've been working continuously with all levels of government, including federal agencies, to expand testing here in Montgomery County. I'm pleased to let you know that we have requested and we have received approval for a drive-through testing location in Montgomery County. This site should be open to the public by early next week. The standing up of this site will not impact local manpower, personal protective equipment, or testing supplies. I want to emphasize that we have a list of critical workforce personnel, including first responders, that will be tested prior to opening up to the public. Later this week, we will release the process for wider access to testing. Next, just some thoughts for the public on taking care of mental health during the COVID-19 health emergency. Even during times of non-stress, it is important that all of us take care of both our physical and mental health. The first thing I want to emphasize is that right now, it's okay to not be okay. This is a very unusual and unprecedented situation that we find ourselves in, and it's changing every single day, and it's perfectly normal to feel unsettled during this time. Treat yourself like you would a good friend. Make some plans and carve out some time to take care of yourself. Second, do your best to stay connected. Use FaceTime, text, or call loved ones and friends. Talk to them about how you're feeling. I can guarantee you, if you admit that you're feeling a little unsettled, whoever you're talking to is going to say, yeah, me too. That will really go a long way to making everyone feel better. And please try to be extra kind to others. It will make you feel good too, and it can go a long way during this time. So again, I've said this every day this week, but reach out to that elderly neighbor. Maybe you can help get them some groceries. If you have a neighbor that you know has a young child at home, but they still have to work from home or work at their job site, see if you can help them out, assuming that your household doesn't have any symptoms and there's no problem there. The state, if you're feeling overwhelmed or have a mental health emergency, I want to remind you of the Montgomery County Mobile Crisis Unit. They're available 24/7. That number is 855-634-4673, and we have added that to our list of numbers up here. Again, they're available 24/7 for any type of mental health, behavioral health emergency. They're wonderful, and they will respond anywhere in Montgomery County. The state of Pennsylvania has provided new guidance for behavioral health providers to support alternate ways for individuals to seek mental health services through telehealth. So please contact your provider to see if telehealth services are available to you right now. And for parents, so many parents have young kids at home right now that would normally be at school or at daycare. Make sure you reassure them that the grown-ups are doing everything they can, doctors, nurses, and scientists, that it's not on them to solve this problem, that the grown-ups are doing that work and they're working hard and they're working as quickly as they can. Remind them that this will be okay and that this is not our new normal. They will be able to go back to school, they will be able to see their friends whenever they want. That day will come, but for now, we have to be a little bit more careful. It's very important to be truthful with children. Ask them if they have any questions and respond to them with age-appropriate honesty. And do your best to establish a routine. You know, obviously being in school is a great routine for kids. Being out of school, not so much. So it can really throw the schedule off, which can create anxiety in and of itself. So create a new routine. Include outside time with fresh air, work in cleaning and sanitizing around the house twice a day into that routine. So that will help the kids feel empowered that they're helping to solve this. Give your children that power and other ways to help that would work for your family. Tell them that by washing their hands for 20 seconds regularly or using hand sanitizer, they're helping to protect their neighborhood and their community. And acknowledge their feelings with empathy. If isolation is really getting to them, you can acknowledge the same thing that the adults are probably feeling, that it must be so frustrating to not be able to see your friends at school. This is all perfectly normal and appropriate sets of emotions. And finally, for the parents, make sure you take care of yourselves so that you can take care of them too. Kids need to see that the pilot is in control. Give yourselves a break. You can relax those screen time limits a little bit this week, but maybe this will be the week that your child discovers that they actually like to read a book. Wouldn't that be a great thing for all of us? So that's it on the mental health and those suggestions. Next, I just want to put a reminder out there that when you are shopping, please remember that there are other people that are shopping too. So please don't take every last jar of pasta or tomato sauce that's on that shelf. Take a couple and leave a couple behind for somebody else. Toilet paper, that's a whole other thing. I really don't know what we're going to do with all the toilet paper that people have stocked in their homes, but that would be a great thing to share with your neighbors. If you have a lot of toilet paper and your neighbor is out, like, do a solid and give them some toilet paper, because that seems to be the thing that we are most short of right now. So please just remember when you're shopping that everyone else is trying to shop now too. So with that, I'm going to turn over to Commissioner Ken Lawrence for some other updates.
On day 10, toilet paper. made the press conference here. So I want to give an update on, as I've said from the beginning, we want to make sure that our most vulnerable populations are protected during this crisis. So I'm going to share some information. We continue to advise people to isolate in their homes, but we have to remember that there are people who do not have a stable place to call home. So our emergency shelters remain fully operational. And in an attempt to support those who are most vulnerable to COVID-19, Your Way Home has created an emergency fund that will aid those who need emergency rent, hotel accommodations, or other essential resources as a result of the COVID-19 crisis. So to donate, you can visit Your Way Home, Montgomery County, which is www.yourwayhome.org, and click the donate button. And check donations can be mailed to the Montgomery Foundation / Your Way Home at 4 Century Parkway East, Suite 302, Bluebell, PA 19422. And their phone number is 484-532-7387. And all this information will be provided on our website as well. We've heard from many of our businesses here in Montgomery County who are wondering what kind of aid they can get. We do want to share some information about the Small Business Administration's COVID-19 Disaster Relief Program, which you can find information on at www.sba.gov. We spoke with the Pennsylvania Department of Community and Economic Development this morning, and the Commonwealth is finalizing the certification request to the SBA so that lending can begin. The time for a loan application to be approved is not known, but the SBA has stated once a loan is approved, it will take 10 to 18 days for a successful applicant to receive their money. To prepare for the online application, businesses are also encouraged to review the SBA Disaster Business Loan Application Forms at www.disasterloan.sba.gov. And now Commissioner Gale is going to share some public safety and communications information.
Happy St. Patrick's Day, everyone. I know it's not our typical St. Patrick's Day that we're used to, but we'll certainly remember this one for many years to come. I wanted to provide an update on public safety and the best way for the public to stay informed of the evolving situation here in Montgomery County. So every day we're in contact with emergency responder associations, updating them with best practices and staying in communication with them. Also our school districts, public and private, faith organizations and faith leaders, and I outlined yesterday some ways for the general public to stay involved. I realize that you can't turn on a television without seeing the coronavirus spread on your television, but it's very important that when you are staying informed, that it's accurate information that's verified, and we have professional staff that's working to do so. One of the ways to stay updated is through Ready Monco. This is the most direct way of receiving official county information during an emergency. You can register for free at readymonco.org, and you can choose how you want to receive alerts by phone, text, or email. That's an important service to have regardless of this situation we're currently in. Around the course of the year, we provide updates on Ready Monco. We also have Ready Radio, our Department of Public Safety's Ready Radio Network, which is broadcasting essential information regarding safety, health, and emergency preparedness, including information on the Commonwealth and our neighboring counties. I'd also like to mention that on a daily basis, we're on conference calls with our neighboring counties discussing best practices as well. And something new that we're hoping to start, hopefully tomorrow, I know our staff is in the process of testing this, is broadcasting these live press conferences on our Ready Radio system. So everyone has more access to the live press conferences. We're Facebook living the press conferences. We realize not everyone is on social media, doesn't have a Facebook account, particularly our senior citizens, and Pennsylvania being one of the eldest as far as our population and the amount of senior citizens we have actually in the nation. I believe it's Florida, and we're possibly second. It's important for senior citizens to stay well informed because those with underlying health conditions, you keep hearing, as well as senior citizens, are a vulnerable population that has to be careful during the spread. So we're hoping to have that up and running tomorrow, where through Ready Radio, people can listen to the live press conferences. Those stations are 106.5 FM, that's broadcasted in the Eagleville area of Montgomery County, 105.7 FM, that's in the western region of Montgomery County, western Montgomery County. 92.9 FM, which is in the North Penn area, Lansdale. 92.1 FM, which is in the Horsham and Fort Washington region. And 105.7, which is the Plymouth Meeting, Conshohocken region. That being said, we do try to respond to as many of our citizens as possible. We realize there's a sense of urgency around the clock, and we have many ways, you see this on the screen, for the residents of Montgomery County to reach us. One of the easiest ways is through email. The public information email for COVID-19 concerns is covid19@montcopa.org. This is live, and trained representatives are here to respond to your emails Monday through Friday from 7 a.m. to 6 p.m. and on the weekends from 10 a.m. to 4 p.m. So hopefully tomorrow we'll have the Ready Radio station up and running with this live conference, and we're doing our best to keep you updated with accurate and verified information. I'll turn it back to Commissioner Markovich.
All right, thank you, gentlemen, and I will take your questions.
Do you have any guidance, advice on how the public testing site will open when it opens, when or will operate when it opens, who should go there and how they should go there?
I do not have that yet. That's all still being worked out. As soon as I have that information, I'll make that public.
When you talk about community spread, just to emphasize how serious this now becomes, is this a case of you walk into a store and it's on a surface, or it's in the air, or you can near someone near the checkout? Explain that.
So what community spread means is that we have an individual who's a presumptive positive for the coronavirus, and we are unable, when we do our contact tracing, to track that person back to a known presumptive positive, which means that they did catch it presumably somewhere in the community. That's very precisely what that term means. After that, I can't comment or speculate on how they caught it in the community. It just simply means that we are unable to trace a direct contact back to someone who was a presumptive positive.
I have some follow-ups about the sites. These may be under the same, this may be the same answer, you may not know yet, but any sense whether these are going to be walk-up as well as getting referrals from doctors, or you can only go if you have a referral from a doctor? Can you go if you're asymptomatic as well as symptomatic? Any specifics like that?
Of all of those options, the only specific that I can give you is that it will be a drive-through. I cannot answer any of those other questions today.
Okay. And any plans for any additional sites beyond the first one?
I can't answer that today either. It's a very rapidly evolving situation.
Are there any concerns, or are you getting any first responders and medical professionals? Do they have the equipment they need, the masks, glasses, and everything?
We have prioritized making sure that our first responders, paramedics, and others have the personal protective equipment that they need. We are in short supply, but we have enough right now, and I believe we are due to get some additional supplies soon. So far we are okay.
Can you give an update on recoveries? How people are doing with recoveries?
I
You
cannot
can't.
have
You just
that
don't know.
information. No, I don't know.
And what is the span of it? We think lasts within an individual 12 days, or it's different per individual?
I think it varies. Yeah, it just depends on the individual. You know, we've talked about 80% of the people don't even necessarily know they were sick or had very mild symptoms. It seems in those individuals, at least their awareness of it is relatively brief. Those with more serious signs and symptoms, I think it can last days to even weeks. I'm just basing that on what we saw in China and some of these other countries. We don't really have great data for the US yet.
And that is one thing that encourages the testing. A lot of people want more testing in order to get more information so that then we can prepare for it.
You know, I really am very empathetic with the public's desire for information as to whether or not they're positive. I get that. But as I stressed before, testing is not broadly or widely available. And even with a new testing site, it's still not going to be widely available. So I urge individuals who have the symptoms of COVID-19, which are a dry cough, a temperature above 100.4, and possibly some difficulty breathing or shortness of breath. If the symptoms are on the milder side, just stay home and self-isolate. knowing that you're positive or not is not going to impact any specific treatment because there is no treatment for COVID-19. So I'm really very empathetic with wanting to know. That's a very human. In this moment where our resources are scarce and we must prioritize our first responders, paramedics, hospital workers, people like that, we just have to say we might not be able to answer every person's question about whether or not they're positive. That's just the reality that we're in.
Does the testing use the protective equipment? Does it use up that equipment faster, and is that a concern with testing?
Well, depending upon how the testing is conducted, typically the person obtaining the swabs, which is either a throat swab, a nasal swab, or both, is in full personal protective equipment. And then they have to change, at a minimum, their gloves between each patient, especially if they touch that patient. And if that patient happened to cough while they were standing there, then they would have to change everything. So it just depends on each situation, but we can go through a lot of it with testing. So we have to be mindful of that.
And is that a concern when you look at the graphic behind you and you worry about that possible spike? Is it a concern that equipment might be needed on the back end of this rather than on the front end of testing?
The equipment that will be made available to us for the testing and this new site that I mentioned is all coming from other resources. It is not being taken locally.
One piece of advice that's gone around a lot in the last few days is the advice to behave from here on out as if you already have the virus. In the context of the issue with community spread and somebody being an asymptomatic carrier. Could you talk about that a little bit?
So that is the thinking behind all of this advice to just stay home. Because it's certainly possible that there are individuals who are carrying the virus, who are not experiencing symptoms, or they're experiencing symptoms that are so mild that they don't associate it with COVID-19, and that those individuals could potentially be contagious. So the more that we can stay home, the more that we can practice social distancing, as we're illustrating up here. As I said 5 or 6 or 7 days ago, no handshakes, no hugs, that stuff's done. The more that we can all act that way and be very thoughtful and judicious about when we do go out to buy groceries, that will just help our whole community. It will protect the elderly, it will protect those with serious underlying medical conditions and those who are immunocompromised, and it will help protect our first responders and our hospitals.
Any idea how much longer this lasts? I know it's a question we get. I know it's probably a question going on.
If I knew that, and
There's
I
no
could
way to
advise
predict right
people
now.
trying to decide whether to buy or sell their stocks, it would be quite something. But
Gotta
I
ask. I'm
really
being
don't
asked the
know.
question. I have to ask.
Yeah. I think, my hope is that, as you've heard me say many, many times, we've really tried hard to learn from everyone who came before us. I consider us extraordinarily fortunate that we were not the first in the United States. And so if you think about where we're at, without even not a week had gone by before we had our first, since we were notified of our first 2 presumptive cases, that we had our schools closed, for instance. And we were already, and even the day before that, I was talking about mitigation strategies and social distancing. I think when you look at other places in this country, they didn't maybe have the opportunity to move as quickly because there just wasn't as much information out there. Remember, and this seems almost hard to believe, the first case that was admitted to in China was when they announced the death of an individual, and that was something like January 7th or January 10th. That was the first time they acknowledged that there was a case. So think how little time has gone by, and a virus that none of us have seen before. So we have moved very quickly here in Montgomery County to talk about social distancing and mitigation strategies and close our schools and get people out of dining in our restaurants and things like that. So my hope is that these strategies are going to have an impact and that we'll see, not only will we flatten the curve, right? So we'll see that purple bump, not that big yellow one, but that hopefully the duration won't be quite as long as other places have seen, but that is pure speculation on my part. None of us have enough familiarity with this disease to say that with certainty.
What do you say to the people who packed up from Montgomery County and other places and headed to the mountains or the shore or other states during this time?
I don't really have anything to say to them. I hope that they're checking their temperatures and practicing all of these social distancing strategies. The virus could be anywhere, and they might think that they're somewhere safe, but there's no way to know that with certainty. And maybe they should just stay there for a while and not potentially bring something back here to Montgomery County. So again, stay home and go out only if you need to.
How does, if people hear the message of, if you have minor symptoms, don't get tested, how does that affect the contact tracing, and are we kind of past that now with the amount that we have? Is it just, here we are?
So, I'm not saying that in the perfect world those folks wouldn't get tested even with minor symptoms. I'm just trying to share the reality of our current situation, which is that people with mild symptoms who are otherwise healthy and can self-isolate at home are not our top priority for testing. It could be that over the next couple weeks we'll have enough resources that we can test people like that, but we're just not quite there yet. And given that there's no treatment other than taking something to reduce your fever, maybe help a cough, knowing the test results won't help in terms of treatment. And if you think you have it, you should self-isolate. So to your bigger point of, are we sort of moving past that point where the individual contact tracing is critical to containing this disease? I think it's fair to say we are moving past that point. I started talking about that really about the middle of last week, that it was becoming obvious to us as we looked at that contact tracing and how many people are in quarantine. That's part of why I'm sharing those quarantine numbers, just to give you a sense of how many people have already, that we know about, had direct exposure to COVID-19. So I think we are still doing contact tracing. I think it's very important to give people as much information as we can. But at some point, we're going to start to see more and more community spread, and it's going to be difficult to do that contact tracing because people really don't know where they got it. And by the way, to put that into context, this was expected, all right? I don't want that to frighten anybody. In a communicable disease like this that is extremely contagious, we make every effort that we can to contain it, but if we can't contain it, then it is inevitable that we will see community spread. And the point of that is, take these mitigation measures seriously. Try to stay home as much as you can. Limit your grocery store trips, limit your pharmacy trips. Maybe you and a neighbor can alternate. One takes one, goes one day, and the other person goes the next time, right? That's what that community spread message is really about, to just give people that awareness, not to panic, not to be worried so much about themselves, particularly if they're healthy, but to take these social distancing messages seriously. All right, everybody, thank you. We'll see you tomorrow at 3.